of 3-minute rapid fire presentations. And with these presentations, we will not have any time for questions and answers. I must firstly apologize to the presenters in that we are running a little bit late. Thank you for your patience. And I would like now to call on Krupa Patel, Krupa, who is joining us from Michigan State University. And this is one of the joys of hosting a seminar in a virtual way, in that Krupa can join us today from Michigan. So Krupa, you are very welcome. And I would now like to ask you to present on suicide among adults during COVID-19 pandemic, rates and trends. Thank you, Krupa. Krupa, you are muted.
Sorry.
Yeah, sorry.
Can everyone hear me?
Yes, now we can.
Okay, thank you. All right, so my topic is suicide among adults during the COVID-19 pandemic, rates and trends. I'm a tele-geriatric research fellow at Michigan State University in East Lansing, Michigan, and I'm also a geriatric psychiatry extern at Zucker Hillside Hospital in Queens, New York. So, the introduction, mental health problems were heterogeneously increased during the COVID-19 pandemic. The pandemic promoted exacerbation of existing suicide risk factors such as illicit drugs and alcohol use, access to lethal means, and social disconnectedness. According to the CDC, Center for Disease Control, 40% of US adults reported symptoms of depression, anxiety, or increased substance use during COVID-19, and 10.7% of participants reported suicidal ideation. This study aimed to compare suicide rates among the adult population ages 18 to 64 years old in Marion County, Indiana in 2019 and 2020. The data for 2019 and 2020 was abstracted from coroner's records in Marion, Indiana. Marion County is the most diverse county in Indiana. The largest ethnic group is whites at 52.5%. Blacks come in second at 27.5%. Third is Latinos, or the Hispanic population, which is growing to 13.2%, followed by Asians with the biggest increase in growth at 4.1%. So it's a fairly good representation due to the diversity and being the largest county in Indiana, which is a large state in the United States. In 2019 and 2020, a cumulative total of 130 and 157 suicide cases were reported respectively. So that included basically child and adolescent adults and the geriatric population. We identified 104 adult suicide cases in 2019 out of 130, and 116 adult suicide cases in 2020 out of 157, with the age range of 18 to 64 years. We analyzed the data for age, gender, race, job, marital status, and the method of suicide. So going on to results now, a total of 80% of adult suicide cases were identified in 2019 and 74% of adult suicide cases were identified in 2020. From 2019 to 2020, adult suicides increased by 11.5% from 104 to 116 cases. In both 2019 and 2020, adult suicides were highest in the month of January. From 2019 to 2020, average age decreased from 39.6 years of age to 35.7 years of age. Male to female ratio decreased from 3.5 to 1 to 2.6 to 1. So males basically decreased, female suicides increased from 20 to 26%, which is a 30% rise. The majority were white, about 75%, and we did not observe a change in race between 2019 and 2020. Suicides among the employed increased from 36.5% to 43.1%, which is an 18% rise. Suicides among the unmarried increased from 47.1% to 58.6%, which is a 25% rise. Regarding the method of suicide, gunshot wound was the most common method during both years, and that increased from 58.6% in 2019 to 63.7% in 2020, and that was a 9% rise. Drug toxicity increased from 1.9% to 4.3%, which was 125% rise, doubling almost. So in conclusion, suicide rates among adults increased by 11.5% in Marion County, Indiana from 2019 to 2020. While white males had the highest suicide rates during both years, females' suicides increased by about 26% in 2020. So I have 30% here. Average age of those who died by suicide was younger in 2020, about 39 to 35 years. A rise in suicide was seen in unmarried and employed individuals. Suicide by gunshot wounds and drug toxicity increased. Our findings echoed the findings of the Center for Disease Control. And so based on our study, public health measures which target certain population groups such as youth, females, unmarried, and employed individuals can mitigate suicide rates during a global pandemic. And I again want to highlight, the fact that employed individuals during a global pandemic had a higher, a rise in suicide rates was something that is quite different compared to normally where you would see it in unemployed individuals. And I think that has particularly something to do with the stress of the pandemic, maybe healthcare workers working during this time, as well as, the fear of contracting COVID for people that were actually employed. So that ends my presentation. These are the references. And I just want to say a special thanks to Ms. Alfarina McGinty and Dr. Abuzar of the Marion County Coroner's Office for providing the data set, and to Dr. Nader Abdelrahman, who is the geriatrician and the program director of the research fellowship, which I'm a part of. And I'd also like to thank the rest of my co-authors who I've listed on the bottom here. Thank you.
Thank you, Krupa. Very well done. Very interesting presentation, and I'm very tempted to ask questions, but I can't because that is the format of this session. So thank you. We will move to the next presenter.
Okay.
Thank you.
Thank you.
I'd now like to ask Kelly, Kelly Brown. Kelly, would you like to present? Thank you, Kelly. Kelly joins us. Kelly is also joining us from abroad. Kelly is with the School of Applied Social Studies in the University of Brighton. You're welcome, Kelly. And
thank you.
I would like you please to give your presentation entitled An Exploration of the Impact of Client Suicide on Mental Health Social Workers. Thank you, Kelly.
Thank you. Get this up here. Well, thank you very much for inviting me along today to talk about this. Basically, I have a research proposal here which hasn't quite been carried out. So I thought what the best thing to do today would be is to talk through my literature review, because I think there's some very interesting findings that has come out of it. Let me start the slideshow. Brilliant. So the research aim was to explore and investigate the impact on social workers from an adult mental health setting who experienced the suicide of a client. However, there was a lack of studies relevant to the research question. Therefore, I included literature, including the wider professional network. I also included a wider date range than what I would have liked to. Social workers are likely to encounter suicidal individuals across all their fields of practice. More than 90% of social workers have worked with at least one client at risk of suicide. Research notes there's about a third of social workers have experienced fatal suicidal behaviour. They have various personal and professional reactions to this. Family members and friends are often identified as the survivors of suicide. However, the mental health professionals who work with the clients are often overlooked by general society. Social work clinician survivors is a term used to describe social workers who are surviving the fatal or non-fatal suicidal behaviour of clients. Social workers' attitudes towards clients are affected by factors such as their own suicidal behaviours, age, gender, or any type of experience they've previously had with suicide. Social workers may feel intense grief, loss, and sometimes depression. One study found social workers have emotional reactions long after the event, and the trauma can be re-triggered by a sound or a smell, and memories did not fade. Indirectly, the families of these mental health social workers may also be impacted. There's a greater possibility of grief depending on how close the clinician and the victim relationship was. However, the suicide of a client has been shown to negatively impact the wider team and management. Mangorian wrote, "The suicide of a patient is arguably the most traumatic event that can occur. The suicide of a client may lead the social worker to question their own professional ability and practice." Gitlin describes the emotions occurring in two phases. First is shock and disbelief, and second is possible shame, fear, and change in practice. Without adequate education and training on coping with the impact of client suicidal behaviours and attempts, social workers are at risk of compassion fatigue and burnout. However, there's overwhelming evidence to suggest there's not enough training provided to professionals working in the field of mental health. There's some evidence to suggest many professionals may avoid such training. One such reason that was given was time pressure from social workers, who on average, according to the British Association of Social Workers, work 11 hours over their contracted hours per week. Social workers may have to justify their practice at a coroner's court. However, it's important to note the coroner's court is not there to apportion blame onto the social workers. According to one professional, attending coroner's court was the biggest stressor in her 31-year career. The trauma experienced by a clinician after the death of a client can be impacted upon depending on how they were told the news. If the news was given in an uncaring and disregarding manner, it would spark negative reactions. Communicating effectively after suicide is crucial in reducing isolation and to begin the process of exploring feelings and concerns. It can also reduce emotional scarring, limiting the impact the event has on the social worker. Supervisory support is more important than support from family or friends when supporting a professional who's experienced the suicide of a client. Without this adequate support, the individual is often left with feelings of unresolved guilt, grief, anxiety, and shame, leading to self-doubt and worries about competence as a professional. The conclusion to this is to prevent suicide and the impact it has on professionals, we need to adequately fund and make time for training for professionals in the area of suicide. Social workers are one of the fastest growing groups of mental health professionals, and they're uniquely positioned to prevent suicide-related behaviours. I just have some notes up here on my proposed study, and this is my references. Thank you very much for listening.
Thank you very much, Kelly. Thank you for fitting so much into such a short time frame. And again, I feel the inclination to ask a question, but I can't.
No problem.
Thank you for that presentation. Thank you. And now I would like to invite Krupa to come back and to give us her second presentation. Krupa's second presentation is entitled "Suicide Among Adults During the COVID-19 Pandemic."
Yes.
Excuse me, sorry, amongst the elderly, pardon me. Sorry.
Among the elderly, thank you.
Sorry, Krupa.
Okay, so my topic is suicide among the elderly during the COVID-19 pandemic. So suicide behavior among seniors is considered a significant public health problem in many countries. Its rates in the United States have increased steadily, especially in the life course of older white men, estimated at 48.7 in every 100,000. Studies have described many stressors that play a role in attempting or dying by suicide in this age group: chronic physical illness, mental illness, and social isolation. However, the influence of pandemics on suicide rates is not fully addressed, particularly those with lockdowns and limited social interactions. The study aimed to compare suicide rates among the geriatric population, 65 and older, in Marion County, Indiana in 2019 and 2020. The data was, again, the same as the adult population. It was for 2019 and 2020. It was abstracted from coroner's records in Marion, Indiana. In 2019 and 2020, a cumulative of 130 and 157 suicide cases were reported respectively. We identified 22 elderly suicide cases in 2019 and 34 elderly suicide cases in 2020, with an age range of 65 to 94 years. We analyzed the data for age, race, gender, job, marital status, and the method of suicide. So going on to results, a total of 17% of elderly suicide cases were identified in 2019, and 22% of elderly suicide cases were identified in 2020. From 2019 to 2020, elderly suicides increased by 55% from 22 to 34 cases. In both 2019 and 2020, elderly suicides were highest in the month of August. From 2019 to 2020, average age was the same. It was approximately 76 years old. Male to female ratio increased from 5 to 10 to 10 to 1. Almost all were white. No change was observed in race. Suicides among the unemployed increased from 10 to 20%. That was a 100% rise. And this is in contrast to what we saw earlier with the adults, where suicides among the employed increased. Suicides among widowed increased from 18% to 35%, which is a 95% rise. Regarding method of suicide, gunshot wound, again, was the most common. It increased from 73% to 86%, which is a 15% rise. So in conclusion, suicide rates among the elderly increased by 55% in Marion County, Indiana. Male to female ratio increased, hence, more males died by suicide. A rise in suicide was seen in widowed and unemployed individuals. Suicide by gunshot wound also increased. We believe COVID-19 pandemic lockdown and the limited social interaction have contributed to the rise seen in suicide among elderly in 2020. Urgent focus should be placed on vulnerable subgroups such as elderly white males who were widowed and or unemployed during the COVID-19 pandemic. So the strength of both the adult and the geriatric, research that we have done is that the data was abstracted from coroner's data from a very diverse county in the United States, Marion County, Indiana. The limitation is we analyzed we had an analysis of a smaller sample size, so that limited our analysis of certain racial and ethnic groups. So these are our references, and again, the same contributions. A special thanks to Ms. Alfarina McGinty and Dr. Abuzar of the Marion County Coroner's Office for the data set, and Dr. Nader Abdelrahman, who is my program director for the Research Fellowship Program, as well as the rest of my co-authors. Thank you.
Thank you, Krupa, and thank you for sticking to time, unlike us from the earlier part of the day. But this brings to an end our morning session. As I mentioned earlier, there are prizes for both the 10-minute presentations and the 3-minute presentations. And the prize giving and closing remarks of this seminar will be at approximately 3:30 today. So please, if you can, come back in the afternoon for the master classes, of which there will be 4, and that will be followed by the closing remarks and the prize giving. So thank you all for your presentations. Thank you.